your name again and which company are you with?
My name is Jorge Cortell, and my company is Kanteron Systems.
Kanteron Systems?
Kanteron Systems.
Great. And what does Kanteron Systems do?
We do software, healthcare software. It's open source free software.
Wow.
And we specialize in imaging, PACS, workstations for diagnostic imaging. But we also have some things that are pretty new, like augmented reality for surgery, and pathology PACS, and electronic medical records.
Okay. So then what exactly is your software doing with these imaging?
Basically what we do that is different from what other people are doing. Okay, we do have the basic packs, which is a way to store and serve those medical images in a hospital. You get the x-rays, the CT scans, etc. And they get served to doctors inside the network or outside. If you have a diagnostic workstation, you can work with those images, which are in a special format called ICOM. And you can measure and you can turn them into 3D. With our software, you can turn them into 5D, you can fuse them, you can go a little bit further. And since it is not limited by licenses, then you can have as many users, as many modalities, as many connections as you like.
And because it's open source, it sounds like this can then also be taken and adopted to various uses within.
Right. It's very flexible. We develop things for large hospitals, for small clinics, for very particular needs. And the fact that it's open source gives the customer the freedom and the tranquility that they are not tied by a contract, or they are running a software they don't know what the code has or any limitation. So it has plenty of advantages.
That's great. And so where is this being used? What are some examples of where it's being used and how it's being used?
Okay, we've been in the market for 6 years. The company started in Spain and has a US subsidiary now. And we're working in 15 countries. Right now, for example, we're leaders in Latin America. The largest PACS server of this kind in Latin America is in Peru. And we install it along with IBM. They're independent software vendor partners. And it manages the whole national health system medical images. We're talking millions and millions of images. We also provided the system for the largest pediatric hospital, which is in London, the Great Ormond Street Hospital, for their cardiology department. We have customers in 15 countries, like I said, and we're growing very fast.
And it sounds like you're sort of expanding to New York right now.
Right. We just opened the US subsidiary. We went through the whole process of listing with the FDA and then setting up the offices and stuff. And we're just now ready to roll and ready to go to market.
That's exciting. So do you have people that you might be working with in New York already, or are you at the point of looking for...
We're hiring.
That's great. So what are, if you were to basically be selling this to someone, what are the advantages that you offer over traditional ways of doing this? It sounds like there's more you can do with the image.
Well, there are advantages in several areas. Number one, the fact that it's free software, like I explained, has advantages by itself.
Absolutely.
The technology also has some advantages. We have some things that most computers don't, like 16-bit color lookup tables, like I said, 5D, like I said, augmented reality in surgery, or a pathology PACS that is open source and standards-based ICOM. So there are some functional advantages and technological advantages. There are some legal and user advantages, and then there is a very reasonable and very attractive price.
That's great. And so the price includes essentially you're setting this up because the software is free.
Exactly. Well,
so what you do is you go in, you work with people to set it up.
Exactly. And that's one thing that makes Kanteron different. And this market is very dominated by very large corporations. They basically have a product and you have to adapt yourself to the product. In our case, it's all the way around. We go in and we install and we configure everything so that the software works the way the user wants. There is a lot of integration in there. There's a lot of work to find out and optimize and make things, the whole process better for the user. in the end, what the user has is this software, this functionality, but he doesn't have to adapt to it, but the software works the way he wants.
That's great. That's great, especially in this field where I feel like a lot of the IT solutions are, a lot of big hospitals and large health centers have trouble kind of implementing these large IT solutions, that this is so flexible.
Yeah, there's a lot of resistance from the user because, learning new systems all the time and then having to adapt and change the way you work.
Yeah.
We also do one thing that most other companies don't, is that we develop for our customers. So if a customer has a special need or works in a way that is not too standard, but he wants to work that way, we work with them and develop those solutions, and mostly included in the price. So he can find the answers. With us, he has solutions, not products.
Yeah, that's wonderful. And what else would you like to tell kind of the health IT community or the Health 2.0 community?
Our future plans are, not something to be shared right now, but we have so many new products, so many different technologies and things that we're going to bring to market in the few coming months, and we're extremely excited, and that's why we decided to come to the States. We started in other countries, in other parts of the world, because number one, we wanted to test those things. Number two, we wanted to be sure when we came to the US that we were ready, that we were on par with others. So we tested ourselves and our products for like I said, 6 years in all parts of the world. Now we're ready. Now we think we can compete head to head with anyone. And we are about to bring so many new things that we hope we're going to make a splash.
That's amazing. That's great.
So basically with Kanteron systems, you have several things that you don't find with competing companies and products. Besides the fact that it's open source, free software, you have the fact that there are some functionalities like 16-bit call lookup tables, 5D, augmented reality in surgery. So there are technical advantages to what we do and what we offer. And beyond that, the way we work, we offer the customer a lot of solutions that are customized. We develop for them and we adapt to the way they work, not make them work the way our software does. So every time we do an installation, there's an integration, there is a process to make things very, very easy for the user. So they have something that they like to work with, and something that is very useful, and something they don't have to replace systems, they don't have to learn new things all the time, but they can, of course, there is a price difference with all these very large international solutions being offered in the market. So, considering all those facts, the legal, license, free software open source situation, the functionality and technology, the price, and the fact that we work with the customer to offer solutions that a lot of times are particularly customized to them, I think it makes Kanteron systems a very nice offer.